Every day we breathe in air to get oxygen into our lungs, but we can also breathe in things like viruses, bacteria, and fungi. People with CF have a problem with lung infections because of the thick, sticky mucus that's in their lungs. Our normal response to infection is to fight it off with inflammation, but unfortunately in people with CF, the inflammation doesn't actually kill all the bacteria, and ultimately it causes damage to the airways. And damaged airways don't clear mucus out of the airways as well. And so you get into this vicious cycle of infection, inflammation, decreased mucus clearance, and ultimately, over time, when that cycle repeats itself over and over, damaged airways that lead to decreased lung function. We're currently doing a large range of trials looking at how to treat infections in people with cystic fibrosis. So for example, there are 2 studies called PREDICT and PATIENCE that are looking at non-tuberculous mycobacteria infections. In the patient study, we're actually seeing which antibiotics are the right antibiotics and for how long to treat somebody with non-tuberculous mycobacteria. In the PREDICT study, we're trying to determine when is the right time to start those antibiotics. Additionally, there's a study called STOP. The STOP study is trying to determine the appropriate length of IV antibiotics when someone experiences a pulmonary exacerbation. A pulmonary exacerbation is when someone's symptoms increase. In this study, we'll determine whether 10, 14 days, or 21 days is the right length of therapy for treating someone with intravenous antibiotics when they're experiencing a pulmonary exacerbation. We currently have approved therapies for chronic infections with Pseudomonas, but we don't have approved therapies for chronic infection with methicillin-resistant Staph aureus. In a trial going on right now, we're actually testing inhaled vancomycin to see if it will improve pulmonary exacerbation rate and lung function in people with chronic MRSA infections. There are a number of innovative approaches being used to treat infections in people with cystic fibrosis. One of those innovative approaches is intravenous gallium. It was shown in the lab to actually be very useful for multi-drug resistant Pseudomonas, and a trial has recently completed enrollment, and we hope to have results later this year. We're also looking at drugs that can prevent the side effects from common antibiotics. So for example, the aminoglycosides, which include amikacin, tobramycin, and gentamicin, have the risk of causing hearing loss. In an early phase study, we are looking at a drug that could prevent that hearing loss from those antibiotics. In the next 5 years, we're very excited about the possibility of having new inhaled and oral antibiotics to treat traditional infections in people with cystic fibrosis. But we're also very excited about the innovative approaches to treating multi-drug resistant infections. Ultimately, we hope that these drugs will make people feel better, have less exacerbations, and overall live much longer, healthier lives.